Healthcare has become a topic of passionate debate in the United States. No one doubts that America's healthcare system needs change or that urgent reforms are required to ensure access to the world's best medical care. But in an attempt to justify radical reforms to the Patient Protection and Affordable Care Act of March 2010, its supporters have vilified private insurers and repeatedly criticized the quality of U.S. medical care. In Excellent Health revisits and analyzes the documents and statistics used to denigrate the quality of American healthcare and reaches far different conclusions. Author Scott Atlas presents the facts, as documented in scientific and medical journals, and shows how medical care quality in the United States does compare favorably to that of other countries in the developed world.
Much of the impetus for the radical healthcare reform law is the WHO report that ranked 191 countries in terms of health system quality. And we can see right off the top that the U.S. ranked 37th, keeping company with countries like Costa Rica, Slovenia, Croatia, and others, not exactly paradigms of excellence in healthcare. Fact is that the academic literature has thoroughly discredited the WHO report, even though it keeps being used as the basis for reforms. Indeed, 9 years later, the head of health for the OECD simply stated, "Health analysts don't like to talk about the report in polite company. It's one of those things we wish would go away." And when you look closely at the data, there are severe problems, including highly subjective inputs, inputs that have nothing to do with healthcare quality, measurement errors, and the fact that almost 2/3 of the ranking was based on equality rather than quality. Researchers in Iowa also looked at some of the key criteria that were used, specifically life expectancy, where the U.S. ranked 42nd in the world. And when we look at the chart of the OECD nations, we see that the U.S. is toward the bottom. But when the researchers in Iowa standardized the numbers for controlling for differences in suicides and immediate death from motor vehicle accidents, we see the U.S. ranking soars all the way to be number 1 amongst all OECD nations. Similarly, infant mortality is a statistic that many people use in the ranking, including the WHO. When we look at overall infant mortality, again, the U.S. ranks low compared to economically developed countries. But when we look at infants that actually use the healthcare system, and that is sick babies who are premature, the U.S. soars toward the top, only behind Scandinavian countries with very different patient populations. We look at also disease outcomes and see that the U.S. is superior to the countries of Western Europe, many of which serve as the so-called model for healthcare reform in the United States. For all common as well as rare cancers, the U.S. patients have better 5-year survival. So the bottom line is, yes, healthcare needs to be reformed in the U.S., but let's focus on costs. Quality is not the problem. And that reform should be reforming private health insurance markets, introducing substantive tax reforms, and reducing the government's role as direct insurer to reduce costs but maintain the system's excellence.
In Excellent Health sets the record straight on American healthcare. Countering popular criticism of medical care quality in the United States, this book exposes the facts and outlines a complete reform plan that maintains choice and access to excellence. Pick up your copy today.